I'm going to answer those quiz questions over the cardiovascular system, and this is the diagram of the heart I drew to help the answer. Question number 1, describe the 3 major blood vessels that belong to the cardiovascular system. So those 3 major vessels would be arteries and veins and capillaries. So arteries, they transport the blood away from the heart. So the heart is just pumping those bloods out the way, and then they will be transported via arteries, and they are usually under higher pressure, and the walls are pretty thick and flexible to bear those pressures. And veins is the opposite. They just returns the blood back towards the heart. They just transport it back, and they are usually under lower pressure, and the walls are not as thick or flexible as artery walls. And capillaries is they are surrounding those body cells and tissues to deliver the oxygens and nutrients. Question number 2, compare and contrast the pulmonary circuit and systemic circuit. So both of them, they are both helping the blood circulation in the body, but the pulmonary circuit is more associated with the lung area. So they are sending the oxygen poor and the carbon dioxide rich blood to the lungs. They are sending those oxygen poor blood to the lungs to pick up some more oxygen, and they can also throw away those carbon dioxide that has been accumulated in the body. So, and then the systemic circuit will send the oxygen rich blood to all the body cells in the body. Question number 3, draw a diagram of the heart and label its part, and use this diagram to discuss the pathway of the blood through the heart. So this is the right side of the heart, and this is the left side, even though they are appearing on my left side in the diagram, and this is the right side of the diagram, which makes me really confused. So this is there are 4 chambers, so right atrium, and right ventricle, and left atrium and left ventricle. And there are 4 major valves as well. So the pulmonary valve, and this is tricuspid valve, and this is the mitral valve, and this is the aortic valve. So there is going to be the 4 major valves. And some vessels here, this is the vena cava. They are just bringing those blood to the right atrium. And also the pulmonary artery, they takes blood from the right ventricle to the lungs, and the pulmonary vein, they just brings blood back from the lung into the right atrium. So, and also this aorta is they are just taking the blood from the left ventricle to they are just distributing all those blood into the body. So, okay, so first is the blood, that is low in oxygen, and they are also high in carbon dioxide. They are just coming into right atrium through the vena cava, and those blood passes through the tricuspid valve to enter the right ventricle, and then it passes through the pulmonary valve to enter those pulmonary arteries. So blood goes to the lungs to pick up some oxygen and throw away those carbon dioxide. So there's those gas exchange will happen there, and those now the blood is just rich in oxygen and low in carbon dioxide. They are entering the left ventricle. Oh no, they are entering the left atrium through the pulmonary valve here. They are entering back, and they are just going through the mitral valve to the left ventricle, mitral valve to the left ventricle. And then blood passes through the aortic valve to go to the aortas they are going, they are all distributed, they will be distributed into all the body cells through the body here. So this is how blood how blood goes to the lungs and pumping back to all the bodies. And question number 4, explain what causes the sound of our heartbeat. So the heartbeat sounds are from the kind of vibration in our heart, and it is also related to the sounds of our valve closing sound. They are just associated with our valve closing down. So the sounds comes in pairs like a locked up, locked up, locked up, locked up, locked up. So the first part is during the systole. They are just pumping our heart is pumping. The sound it's the sounds of a mitral valve. So sounds of the mitral and tricuspid valve, they are just pumping. So they are contracts, and that is the sound of those valve closing. And the second part is during the diastole. They are just the heart is filling the blood, and they are just refilling those blood, and those sounds of aortic valve and aortic and pulmonary valve, they are closing, so they can refill the blood. So basically the heartbeat sound is related to our heart valve, major valve are closing down, and this makes the sound which comes in pair. And question number 5, describe how electrocardiograms can be used to determine heart abnormalities. So this electrocardiogram ECG, they are recording the electrical signal from the heart. I mean, the electrode will be placed on the body, on the skin, and they will just record those heartbeats. So each heartbeat, the electric impulse travels through the heart, and then from the electrode, and they will generate kind of the pattern, and physicians will read those patterns. And the electrocardiogram is just made of three different patterns, three different waves, and P waves and R waves and T waves. So they are made up of those waves, and they will make all the patterns. So they will be read by the physicians. So they can show all those waves are associated with the area of certain cardiac system, the conduction system. So the pattern will be read by the physicians, and they can tell what area has the problem, what area is not working right, things like that. And question number 6, use the term diastole and systole to describe the heart and blood pressure. So systole, blood pressure has two numbers, big numbers and small numbers, top and bottom numbers. So the top number is just when the heart is pumping the blood. So they are just working. The heart is working, and we just call it systolic blood pressure. And systolic blood pressure. blood pressure is just checked when the heart is pumping and filling the blood. Well, so is the pressure is inside the artery. So when the heart is just contract and pump the blood. And in the meantime, the diastolic pressure means it's just the bottom number. So it's the pressure, the heart is just refilling with the blood. They are kind of at rest. They are resting between those heartbeats. So this is the bottom number, the diastolic number, and those top number is just the when the heart. This is top number is showing when the heart is pumping and contracting. So those two numbers are just consisting those our blood pressure number.